Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we're going to learn about, well, one thing, which is really two things. Hampton University's Conference on the Black Family, which is coming up. But this year we'll be focusing on diabetes. And that's a lesson that we all need to learn a little bit more about. My guests are Patricia Richards-Spruill and Dr. Wayne Harris from Hampton University. Welcome.
Thank you. Thank you for having us.
Now, I've heard of the Conference on the Family forever and ever, but it is usually more about sociological and political factors and things like that. You guys have a different focus this year.
Good morning. Thank you, Robin, for having us. And yes, our focus is slightly different. Let me start historically by saying that our president, Dr. Harvey, began discussions of prevailing issues in African American families about almost 40 years ago, 37 years ago.
Who was talking about it back then? That's such foresight, isn't it?
That's exactly right. And what people don't know is that the hosting of the conference rotates between the various schools and colleges of the university. So this year...
What a smart answer, because everybody has that different perspective. And if you look at, 40 years of discussions, you've probably hit so many different topics.
That's right. So the School of Pharmacy this year is focusing on a health issue that is plaguing our country, that is diabetes. And the theme for the conference is Controlling Diabetes, a call to action for minority families. And we've developed designed a program to serve as a public health intervention in the Hampton Roads area, inviting professionals and laypersons to come together to learn about diabetes and the fact that it is significantly preventable and it's controllable. And we need to focus on both aspects of that disease. And that's the focus for the conference this year, and we're very excited about it. The conference...
I'm just going to interrupt for just a second, because I think this is so important. It is an epidemic, really, in this country. I think it's been officially declared, and it does affect pretty much everyone of all ethnic background. But African Americans are disproportionately affected.
Yes, African Americans are disproportionately affected in two primary ways. First of all, the prevalence of diabetes in the African American community is about 1.5 times higher than for the general population.
Oh, I knew it was bad. I didn't know it was that bad.
And secondly, African Americans and other minorities suffer disproportionately from complications from diabetes. Complications that really cause fear in the minds of people, like blindness, kidney damage,
losing a leg,
amputations, etc. All of those things, those are complications of uncontrolled diabetes. Thus our theme. Let's learn how to control diabetes. It will prevent or limit the complications of the disease. And the same kinds of adjustments that need to be made will affect prevention. There are lifestyle changes that are needed, adherence to medication and other forms of therapy, etc. All of those things need to be brought into balance.
Now, I think of that as the role of the physician.
Yes.
The pharmacist, though, has a little different perspective on our health care.
That's true. Pharmacists, first of all, should have, and in most cases do have, an accurate record of all the medications that a person is taking.
Which could have been prescribed by several different physicians. Okay.
And now some people do use more than one pharmacy, unfortunately. So that's one of the issues that we have. We need to get a systematic way of reviewing all the medication that people have and just make sure that they're being used effectively. Studies have shown over the last 20 years that utilization of pharmacists in working with physicians and other health professionals has improved the health outcomes when managing diabetes. Not just the health outcomes, but also the cost of managing the disease per patient. There have been numerous studies that have shown that. Our system doesn't incorporate that benefit into this healthcare system at the moment, but I believe that it will. So this message is about utilizing pharmacists to help to manage diabetes, addressing this epidemic that you mentioned. And the prevalence of diabetes now is 9.3% in our country. That's about 30 million people who are estimated to have diabetes right now.
And that's just with diabetes. There's this pre-diabetes condition.
That's another, yes ma'am.
That is a whole nother population. And that's where intervention can make a big difference. I mean, it can make a difference at any point, right?
It is.
You can if not entirely reverse, you can at least stop some of the complications by making changes.
That's right. In prediabetes, it is preventable to a significant degree. So this large group of people who are, quote, pre-diabetic, it is not a fait accompli that they're going to become diabetic. And the lifestyle modifications, family changes, community changes, we need to work together. And pre-diabetes patients can, to a large extent, prevent the development of the disease. Once the disease has developed, it's about management. Mm-hmm. And that's the other message that we're sending this year and as an ongoing initiative through our university.
Now, I have thought of this, and I tend to think of a disease as affecting one person.
Yes.
But a disease that is partially influenced by lifestyle and culture and external factors is a family thing, because it tends to be, whether it's genetic predisposition or what you eat and how you live your lives,
yes, it
can affect your kids, yourselves, your parents. And that's, I think, where you pull in this whole family aspect.
Absolutely. It affects, for children, the public schools, all schools, because the nurses, et cetera, in the schools have to manage this rather complicated disease, and they have to communicate with the families, and everybody has to be on the same page.
Right, you have kids with type 2 diabetes now.
And especially type 1, yeah, but both of them, yes. So managing diabetes is, when I say family, because of the conference on the Black family, we're talking about minority families. We can't continue to let this disease devastate communities when it's controllable. But it's a call to families in general, mm-hmm, including the larger community family. We all have to work together.
And that's also where you get to the point where, suppose it doesn't affect me, I'm not in that condition, and I can think I can ignore it, but you can't because of the cost. If you don't care even about the people and the human cost, the financial cost of letting that disease get out of control and people develop complications, we're all paying for that under whatever insurance program we're under.
That's right.
It's a huge, and lost production, and kids who don't have the same potential, and lack of people who can qualify for the military because of, there's just so many things that so you're going to get at all this.
Yes, and it's a systems problem.
It is.
There's not a one answer for this. It's a big thing that involves every aspect of the system. And yes, we're trying to get at that, and we're going to get at it by working together. The healthcare systems in the region have to incorporate pharmacy, not just for drug distribution, but for provision of care in management.
Well, anyone with an ongoing disease sees their pharmacist once a month. You get your 30. You might do the mail prescription, in which case you lost that human touch. But otherwise, you're coming in every 30 days.
That's exactly
That's more often than I would see my doctor.
Oh, absolutely. And Mrs. Richards-Spruill and I, as we work with students, the educational system requires that students get experiences at various practice sites. And it's important for us to recognize that to teach students to be able to counsel, to ask questions, to probe that patient who comes to get their diabetes medicine once a month, and their strips and all of the other things that they have to do. What was your glucose this morning? Is a very provocative question.
It is, because it also says, did you remember to check
That's
it?
Right.
Without asking and putting someone on the spot quite
In
as
my
much.
experiences, that leads patients to asking other questions and sharing, I really don't know how to use my meter, or all kinds of things happen from such a simple question as that. So that we've invited a group of important keynote speakers to our conference. The conference will be held March 18th through 20th, just coming up very soon.
Yes.
We've got a keynote speaker on Wednesday who is the director of the National Institute for Diabetes and Digestive and Kidney Diseases.
Oh, wow.
We've got a keynote speaker, the chair of the National Diabetes Education Program, who will come on Thursday for a luncheon session to talk about diabetes advocacy. She's working with CDC and the NIH in her role. And then on Friday for luncheon, we have a the chief pharmacy officer in the United States Public Health Service doing the keynote on talking about this aspect of Healthy People 2020 and the role of pharmacists and the need for more integrated care, et cetera. So those 3 keynotes are going to anchor this program.
And so people who might want to come to the full conference
Yes.
would be, now I was going to say health professionals, pharmacy professionals, but you also added
Laypersons.
right, community
Absolutely.
groups.
Yes, ma'am. We have first of all, the sessions between the keynotes are talking to patients about, you can do this. You need to modify your diet, and here are ways. We can minimize the risk of stroke, for example, et cetera. So there are sessions not targeted primarily to professionals,
But there are some we can go to for free.
Absolutely.
Where maybe we can't either afford the
That's
time or
right.
the registration.
And
so the general populace can come
Yes.
when.
Well, we would invite the general populace without registration. Of course, we're encouraging registration.
Of
and there's
course,
a conference
you've got to pay
website
for a
that.
conference, and
Yes.
there's
But on
bring those
Wednesday
speakers
night,
in.
March 18th at 7:30, is the opening session, and we would invite anyone who would like to come to, and Dr. Griffin Rogers from the NIH will be the keynote speaker. That's open. It will be in Ogden Hall on the university campus, March 18th, beginning at 7:30. On Thursday, in addition to the conference activities, we're having a health fair, an informational health fair, where our students and other professionals will set up tables and provide information on diabetes and cardiovascular diseases and healthy eating. We've got a vendor who's going to have a display on healthy eating.
You know, I bet that's a real challenge among college students.
Absolutely.
Healthy eating.
I have an 18-year-old and a 22-year-old, and one
Yeah.
of them, kind of eats healthy and is dealing with things, and the other couldn't live without junk food.
Oh,
I mean, that
absolutely.
population in particular.
Yes.
And if I could share not only healthy eating, we have someone that's going to talk about healthy shopping
Yes.
and healthy food preparation. Because a lot of people, say, well, okay, I'm going to eat my vegetables, and then they put in too much salt, or they use canned vegetables,
Cook 'em with butter.
Yes.
So we'll have people that are talking about those things as well. And as Dr. Harris mentioned, at the health fair, there's going to be free screening.
So you could check my glucose, right?
Check your
Check
Right
glucose,
there. Yes, ma'am.
A1C, everything right there. We will be talking about, we'll have information on organ donating and organ transplant, and that so often is taboo.
That's a difficult
But we
thing,
need
kidneys
to
are
talk
essential
about
in
it.
this.
We need to
about
talk about
that.
it. And
Yeah.
I went to a program, and I actually had a friend who did a speech. And she had had a kidney transplant, and her speech was entitled "Don't Have One." And I'm like, wait a minute, why is she saying this? And her purpose was to say, don't have one because don't need one.
Prevent
Eat
as
healthy.
many as you can,
Yes,
right,
yes,
right.
prevent it and control it.
So the free activities, the opening session is open to the public, and then the health fair throughout is a morning component and an afternoon component on March 19th.
Okay.
The general public is
And where's
invited.
that?
It will be in the University Student Center,
That's such a
where
gorgeous
most of
building.
yes, ma'am.
I'd go visit that. It's so beautiful.
So we're inviting the public to participate in those things that are free, and we're also inviting the general public to register for the conference, because these sessions are designed for the general population.
Well, and if you look at, again, it is that individual, then family, then community, and
Yes.
we have nonprofits, we have churches, we have a lot of organizations within our community that interact with people and can help with controlling and preventing this epidemic.
Absolutely. And I will also add that we're partnering with the local affiliate of the American Diabetes Association. They will have a table at that during the health fair providing information. So our goal is to identify partners in the community, to get the message out, to assess the needs of this particular community. Because I can't come to Hampton Roads area as a dean of 4.5 years and say, I know what needs to be done. I know that we need to address this epidemic. And I know that pharmacy needs to be involved in it, and more than just providing the medicine. but what are the specific needs of this particular metropolitan statistical area? We've got to work together to assess that need.
What are the needs and what are the strengths? Who can we count
Yes, ma'am.
on
Yes.
to help get involved in this effort?
So our conference this year is a call to action. It's a beginning of an ongoing diabetes initiative, not de-emphasizing any other disease, but this is one with significant cost that is controllable.
That I think is the difference. Like if you think you might have some other disease that you can't do as much about
Yes.
and are reluctant to face, that's still bad.
Yes.
But this one in particular, if you face it, you can really make changes if you learn and if you're willing to do it.
Absolutely.
And that gives us power, but
Yes.
not if we don't take it.
That's right. So the university and the School of Pharmacy is stepping out in the community saying, let's do it.
All right.
Let's take that chance. And it's not really a chance. It's almost guaranteed that if I start walking 2 miles every day like I used to for most of my adult life,
Did you?
I'm going to control my risk of
You are.
getting diabetes. That's the truth.
Well, I'm wearing my pedometer today, but it's not going to show very many steps. I'm not good at, but you're right. And it takes reminders. You can't
Yes.
tell people once.
That's
So-
right. That's
so
right.
this is the call to action.
This is the call to action.
We're inviting people to join us, and it's going to be a continuing effort
That's
over the
right.
long haul.
Over the long haul. Yes,
Okay.
ma'am.
Well, thank you so much. I look forward to
Well,
the
thank
conference.
you.
It sounds wonderful. And maybe you can come back and we can work on this issue again and do more tips for individuals and things
Yes.
like that. Because I think people need to hear things a few times sometimes in order to get that push.
Well, we would be happy to come
Yes,
back.
yes.
Well, thank
and I'd
you.
just like to say, if people want to find out more information about the
Oh,
conference,
great.
please refer to our website, www.hamptonu.edu, and all the conference information is there.
Good.
Once again, we're excited. We've partnered with so many people, and it's going to be an interdisciplinary type program. We have physicians, we have nurses, we have dietitians, and most important, we have our students who are really involved in this process,
Absolutely.
because our students are our future.
Yes, they are. That's for sure.
May
Okay.
I add a phone number?
Sure.
I
Oh,
did-
yeah, go
did
right
put-
ahead.
The general phone number that I'd like people to call is 757-727-5071. That's so if the website doesn't lead people in the way that they want to go, call that number.
Some
and
of
we'll
our
go.
folks aren't as web savvy who might be
Yeah.
watching that, and that's important that we
Yes.
remember that.
Yes.
Thank you.
All right.
Thank you very much.
You're
Well, thank
welcome.
you for
Thank you
having
for
us.
having us.
And thank you. I hope you've learned a little bit more, maybe taken some of the fear away, and you can think about visiting the health fair, attending the conference, or taking a step to learn more about diabetes and how you can prevent it or control it. Thanks for watching.